Okay, good morning once again. I am Karen Richardson Dunn, and I am the Associate Director for Healthy Aging with Partners in Health and Wholeness. Good morning to everyone. I'm going to turn things over for a moment to Chris Purnell, who is the director, of Partners in Health and Wholeness.
Good morning, everyone. Karen, you can give me whatever title you want on a Friday morning. It's all good. Thank you so much for joining us. We have over 80 people registered this morning, which I think Karen and I talk often about this subject. We both have family impacted with dementia and Alzheimer's, so this is very close to our heart, and we are so pleased to be able to bring these experts to you, our incredible audience. As you know, Partners in Health and Wholeness has been around for about 11 years, I think, and we work directly with faith communities all across the state on issues of health and wholeness. And we have a special focus on issues around aging, healthy aging, mental health, and the overdose crisis. So before we get started on this presentation, I just want to offer to anyone attending, please reach out to us if you have special needs or concerns about the health and wholeness of your congregations or communities, and we would love to work with you. Many of you we do work with. It's great to see familiar faces this morning. So please reach out if we can be of assistance, and I'm not going to keep you any longer from the presentation that Karen has for you. Thank you.
Welcome again. Before we get started, I just have a question I would like to ask everyone. I think this is a topic that's important to so many people. In fact, we've had 81 people register for the event. I'm sure not everyone will be on the conversation this morning, but I just want to ask how many of you, and if you could just type this in the chat, how many of you have a loved one who has a diagnosis of Alzheimer's or dementia? If you could just type that in the chat. I'm just reading these responses, and I'm just so moved by how many of you who have been impacted by Alzheimer's and dementia. I want to say that, you know, we are here today mainly because we want to find out how we can take care of ourselves and our children, our loved ones, to prevent the onset of Alzheimer's and dementia. But I also just want to say, my father was diagnosed with Alzheimer's about 5 or 6 years ago. And I just want to say, as a person of faith, in walking this journey with him, it has been extremely challenging. But at the same time, I'm just so grateful for all the moments of grace and mercy that I've experienced as part of this journey. His short-term memory is not very good, which has meant for me that I've gotten to hear all sorts of stories from his boyhood and his childhood that I don't think I ever would have heard. And, you know, he's always had a great sense of humor, but during his Alzheimer's years, that sense of humor has, it's just become so powerful and sweet and gentle. So I just want to say, even though we are walking this journey with people we love, that God is also walking it with us. And I think we can see that in those moments of grace and mercy that are offered to us. So right now, I would just like to take a minute just to hold all of these people in our chat whom you love and who have been affected by these illnesses. And I want to hold all of you as well as the ones who love them and as their caregivers. So if we could just take just some moments to be silent together and hold space for these people that we love and for ourselves. Oh, man. Thank you. Well, now I would like to start our presentation, and I'm going to introduce Corey, who is going to be leading the presentation, as well as 3 of her colleagues from the Alzheimer's Association of Western North Carolina. If you do have questions as Corey is speaking, please feel free to put those in the chat and she will address those. We will also have a formal Q&A when she is finished with her presentation. So we will have plenty of space and time to answer your questions. We usually end at noon, but if we have lots of questions, we can always go over a bit. So please do put your questions forward. And I would like to introduce Courtenay. Courtenay O'Donoghue is the Director of Program Services with the Alzheimer's Association of Western North Carolina. Dr. O'Donoghue has oversight for the education and care and support resources serving the 49 Western North Carolina counties, as well as statewide partnerships. She works with a team of 3 program managers who lead 90+ volunteers across the state in delivering education programs and facilitating caregiver support groups. Dr. O'Donoghue holds a Ph.D. in educational leadership and graduate and undergraduate degrees in English, art history, and religious studies. And on top of all of that, Corey is also the mother to Jackson and is the chaplain for his Boy Scout troop in Matthews, North Carolina. So, Corey, I'm extremely impressed. And I would also like to welcome Corey's colleagues, Karen Owens, Madison Buchanan, and Brooke Valley, who are joining us today. So, Corey, thank you so much, you and your colleagues, for being here with us. And I'm going to turn things over to you now.
Great. Thank you so much, Karen. I will go ahead and share my screen and we'll bring up our slides. So it is an honor to be here, and thank you, Karen, for that moment of sharing. There's a lot that we're going to talk about today, so we'll talk a little bit about a lot, but because we have such varied experiences with Alzheimer's, we will be doing a little bit of level setting just at the beginning. I don't know, do you all hear that? Okay. So if you're not familiar with the Alzheimer's Association, I did want to share who we are and what we do. And of course, you can see our vision. So we work every day, 24/7, towards a world without Alzheimer's disease and all other dementias. And we do that by leading the way to end Alzheimer's through acceleration of global research, driving risk reduction and early detection, and maximizing quality care and support. And you will be getting a copy of these slides at the end. We have listed a lot of our resources in these areas. So if you also have interest in learning more about what we do in science and research, we're certainly going to make that information available to you. I'd like to start just by clarifying language. So obviously we know the terms Alzheimer's and dementia, and very likely you have heard them used interchangeably, when actually they're not. They are different terms. So just for clarity, dementia is actually the term for a body of symptoms related to cognitive impairment. So a decline in memory, reasoning, or other thinking skills. Those kinds of symptoms fall under dementia. Also underneath dementia, if you imagine an umbrella, there are 2 buckets. There is one bucket that includes conditions, acute conditions that manifest these symptoms, but if diagnosed and treated, the individual will resume their normal health conditions and those symptoms will go away. So, we all may know urinary tract infections in the elderly cause incredible dementia symptoms, but even thyroid disease, vitamin deficiencies, nutritional issues, brain tumors. These are all things that can be diagnosed and very often can be treated. There's another bucket under dementia, which includes diseases that are those neurological progressive diseases that are ultimately fatal. And that is where Alzheimer's lives. So when you hear people use those terms, if there is an opportunity to help them understand that Alzheimer's is a type of dementia, Alzheimer's is a cause of dementia, but dementia is also this greater umbrella. Alzheimer's is the most commonly diagnosed of the dementia-related diseases, accounting for, I generally say, 70% of all cases. It is the 6th leading cause of death in the United States and in North Carolina. And of course, it is a progressive brain disease. You may also have heard of Lewy bodies, a frontotemporal lobe. These are in that family as well. What is particularly unpleasant about this disease is that it's often active in our brains many, many years before we even develop these symptoms. And at this point, there is no cure, but we will be talking later about minimizing risk. So we'll talk a little bit about what's possible in the space of minimizing our risk. And a little bit about what's actually happening in the brain. So our brain is the command center for the body. There are 100 billion nerve cells in the brain, and they do not function on their own. They function in relationship to each other. So they all have a particular role in how we create memories, find language, solve problems, take care of ourselves on a daily basis. And then they communicate with each other through these pathways. So in an Alzheimer's brain, there are proteins, amyloid and tau proteins, that are building up. They are forming what we call plaques and tangles. And what those plaques and tangles are doing is twofold. On the one hand, they are suffocating and killing the individual nerve cells. On the other hand, they're coming through and destroying and blocking those communication pathways. So we're losing the brain cells. We're also losing the ability for the remaining brain cells to communicate to each other. And I'm a particularly visual person, so excuse me, I do like to show this slide if you're also visual. On your left side, you're looking at what would be a typical, normal, healthy brain. It's big, it's full. You can see the example of where memory lives and where language lives. And you can see that there's all this wonderful space for those neurons to communicate with each other. On the right-hand side of your screen is what an Alzheimer's brain looks like. And so first thing we might see is it's smaller, it's shrinking. There are lots of big open spaces where there used to be function and pathways. So for example, you can see how little is left of where memory builds, what little is left of where language builds. And you can see the gap between the two. So what is left can't even talk to each other. I do like to use this slide a lot with caregivers, especially as they're struggling. You know, their loved one is changing, their loved one might be exhibiting behaviors, and it's so hard for a caregiver to separate, this is a disease in the brain causing this, versus why is my husband, wife, partner acting like this? Why are they doing this? And it often will help a caregiver to understand that it's not the individual making a conscious, intentional decision to behave that way. This on the right-hand side is what's driving that. So to talk a little bit about who's at risk for this horrible disease, and it's very tongue in cheek, but we do say all of us who have a brain are certainly at risk. Age remains the primary risk factor. So 65 is the typical first benchmark, approximately 1 in 9 seniors over the age of 65. Women at higher risk than men. So women 1 in 6, men 1 in 11. And then 85 is that next benchmark. 1 in 3 seniors over the age of 85 will develop this disease. Family history and heredity certainly put us at risk. So that could be health conditions that run in our family that increase our risk. That could be a component of genetics that may increase our risk. It could also be the more we have an immediate biological blood relative with the disease, the higher it increases our risk. So in my case, my mom has Parkinson's. I had a great aunt who had vascular dementia, another aunt who had Alzheimer's. So that increases my risk exponentially more than somebody who does not have that close immediate. We know more, of course, about chronic lifelong head injuries, and lifestyle may increase our risk. And that's really, when we talk about prevention, we're talking about what can we control? We can't control aging and the normal changes that come with aging. We can't control what we inherit from our families, but we certainly can control aspects of our lifestyle decisions. So we will talk about that in a little bit. Also wanted to share with you, especially as you work in congregations and communities, people of color are at increased risk for Alzheimer's. Hispanic Americans 1.5 times more likely than their white counterparts, and Black Americans twice as likely as their white counterparts. Added to their increased risk is the fact that they experience more discrimination when trying to access healthcare, and they also report being less likely to pursue an early diagnosis or early intervention. So talk a little bit, I want to share a little bit about the warning signs. People often say, oh my gosh, I'm forgetting things, I'm losing words. Does this mean I have Alzheimer's? We change as we age. Our bodies change, our brains do shrink a little bit, depending upon how healthy we were in our earlier years, that's going to impact how we age. So we call these the 10 warning signs of Alzheimer's. And any one of us might experience one or more of these occasionally at some point in our lives. Could be living through a pandemic, could be stress. What is significant about any of these signs when we're talking about red flags that it's not a typical change with aging really is 2 things. And one, the individual is experiencing a decline from a former state of ability. And 2, the change is beginning to interfere with our daily activities of living. So beginning to interfere with how we take care of ourselves, toilet ourselves, bathe ourselves, feed ourselves. And decline from a prior state of ability is not, I like to use my dad as an example. He's about 84 years old, in pretty decent health for his age, although he certainly has some heart issues, and he's also legally blind. And he's a bit of a shoe hound. He's kind of a fashion guy. And over the years, he probably has more shoes than my mother and I combined. Loves them. But a couple of years ago, when I was visiting him, I noticed that he was no longer wearing shoes that he could tie. Instead, he was wearing slip-ons. And, he must have seen me kind of checking that out and wondering about that. And he explained to me that he made a conscious decision to make that change because he's scared of bending over and having to tie his shoes. He still knows how to tie his shoes, but it is much more stable for him to be able to slip on shoes. Versus a change in somebody who stops wearing their shoes because they can't remember how to tie their shoes. Another significant difference when we start to see these warning signs is the ability to retrace our steps. So we lose something, we can't find our car keys. In the healthy brain, we will be able to trace back to where we most likely put those car keys. So I've run in the house, I've tossed my keys because the phone was ringing and I had the groceries, and 2 hours later, I go to look for my keys, can't find them, but I can stop and I can remember and I can replay my steps. In the Alzheimer's brain, it's gone. That ability to retrace our steps is gone. So the item we've lost is gone. That also tends to facilitate, if the item's gone, somebody must have stolen it. And it leads to that horrible kind of anxiety and paranoia. So a couple of these things, these are not intended to help anybody self-diagnose or diagnose a loved one by any means. They're just guides, and again, we may all experience one or more of these. But if you start to see these in yourself or a loved one, it's progressive. That's significant. That's what you need to take note of, to track that and make sure you bring that information to a doctor. It's also very helpful when you see these kinds of changes to try to put it in context. So not just mom is losing things, but, is there a pattern to it? Is it a particular time of day where she tends to lose things? Is something else happening when she tends to lose things? These are all clues, and we play a detective there. So what does this mean for where we are with being able to prevent or treat Alzheimer's? Well, at this point, there is no cure. There is no prevention for Alzheimer's. We can, however, minimize our risk, and we will be talking about that. I did want to just share right now, there are 3 FDA-approved medications on the market, and many of you may be using these with your loved ones when you chat it in. Those 3 approved medications are not a cure. They're not a prevention. They don't stop this disease. What they do is just help to neutralize the symptoms, but they have no effect on the underlying progression of the disease. There's also a medication out by the Merck company that is specifically designed to help treat insomnia in individuals with dementia. And that particular medication has shown to be safer for individuals with dementia. This medication has lower levels of risk of falls that we often see with some of those medications. And sleep is so critically important to brain health, to stability, to routine. What is really exciting that I want to share, we mentioned this while we were just doing our tech check earlier today. This coming Monday, many of you may be following this, may have heard of this, but this coming Monday is a monumental decision in front of the FDA as to whether they are going to approve aducanumab. Aducanumab is a medication that may in fact be the first treatment for earlier onset dementia. I mean, if the FDA approves it, there is still a lot of work to be done. But this is just incredibly exciting. The Alzheimer's Association endorses the FDA approval. We hope to know more on Monday. Clinical trials are also very significant opportunities. Many times we can we can have access to things through clinical trials that are not in the mainstream treatment or management of the disease. So we encourage individuals to look into clinical trials. My colleague Karen will put Trial Match in the chat for you if you're interested. Trial Match is sort of our dating service for clinical trials. It's, rather than go to, say, the CDC and have to research to find trials related to brain health, Trial Match pulls all of those. And you input information, and then what Trial Match does is simply say, here are studies you might be interested in. It's completely up to you whether to pursue that or not. We will not make headway with this disease unless we have individuals in clinical trials. And many, many clinical trials are open to healthy individuals that have some risk factor in their family. So there's probably a clinical trial out there for all of us. Very exciting as we're talking about this. In addition to this pending FDA decision, North Carolina is headquarters to the U.S. Pointer Study, and the U.S. Pointer Study is the first of its kind in our country that is looking at lifestyle interventions. So the association has partnered with Wake Health. The Pointer Study will take place across the country, but it's headquartered and was born right here in our own backyard. It is underway now. So there are cohorts of individuals going through this. U.S. Pointer continues to recruit people as well. So very exciting. U.S. Pointer is based on a number of studies that have been done across the globe, particularly in like the Norway and Denmark. And all of those studies have shown some promise of lifestyle intervention and a decreased risk of cognitive impairment. So we, with U.S. Pointer here in the United States, what is unique about it as well is that we will be bringing through a much more heterogeneous population than some of these other countries. So very excited about that. And you see the links
Corey,
on this. Yes.
could I just interrupt you for a second? We did have a question. Someone had asked about the medication you had just referred to about insomnia and people with dementia. Could you just name that for us?
I will look it up and send it to you. It sounds something like, it starts with a B, biolel. I've got it in my notes. I just don't have it right in front of me. So I'm going to make a note, Karen, and I'll include that in the follow-up. Okay. Unless my Karen back there would be able to Google it. And if you Google Merck insomnia for dementia, she may be able to come up with it before we're done. Also here on this slide, wanted to just give you a link to access other educational programs that we have going on, but particularly the link to the Healthy Living Symposium that is happening next week and is based on research about lifestyle intervention and the positive impact on a decline in cognitive impairment. And maybe I'll just stop here for 1 second. Were there any other questions, Karen, before we proceed, just for clarity of anything that I said?
There's a question about a link for the lifestyle study, but I don't think we have a link specific to that study, but I did put the link in for Trial Match, which would send individuals the information for the Pointer Study.
The other thing too that we could do, Karen, is off our website, off alz.org. I think there's some pointer information there and we could send them that link. Okay.
Also, is Belsomra the name of the medication you had referenced about insomnia?
What is it?
Belsomra, does that sound right?
That may be it. That may be it.
Okay.
It's very important if you are struggling with insomnia with a loved one, very, very important to have a conversation with the physician before you begin to consider that, because there are some medications, things like Ambien, that are very indicative. They increase risk of falls. They tend to increase risk of confusion in individuals. So you want to make sure that you're having a conversation with the physician, and also looking at any other medications your loved one might be on, so that there's no not a bad relationship between the two. I wanted to jump into a little bit about what we know of the faith community, and some of the work that's been done. And I know that we've got two Karens, but I know that your Karen is following up with a toolkit, and we'll have some wonderful things available for you. So when we think about community and we think about faith, and we think about healthy living, we look at 4 components of healthy living: social engagement, nutrition and diet, physical engagement, and cognitive engagement. And, both for the individual, but here on the left side, these bullet points are really speaking to caregivers and what the faith community can offer to caregivers as they go through this journey. And the word goes back to community. So, church, temple, synagogue, mosque, that provides social engagement, connection. It gives a person a continued sense of purpose in the face of what can be a very overwhelming disease. It's a place of familiarity, both for the caregiver, but also for the individual with the disease. And because of all these things, it can be that very important buffer against loneliness and isolation. And we know that loneliness and isolation can lead to health issues, nutritional issues, medication mismanagement that can in turn facilitate or increase, any dementia symptoms that an individual's experiencing. And living in this pandemic, we have certainly looked at this and experienced this as a culture. And then some of the bullets on the other side of the slide is really why is it important to continue to meet an individual's spiritual needs even in the face of this disease? And that is because of that deep-rooted connection. We hold on to that long-term memory. We hold on to those long-term practices. So those aspects of faith, music, prayers, sacraments, objects, an individual may not be able to sit through a worship service they did pre-disease, but we can still bring these aspects to them. And I'm sure that many of you can think about, times when maybe it was your loved one, maybe it was a parishioner, somebody who's in the middle to late stages of Alzheimer's, but they hear that old hymn and they know the words. So it's very important. There is also a group called Us Against Alzheimer's, which is a clergy, it's a coalition of clergy that are looking at Alzheimer's and spirituality in the faith community. So the next 2 slides are really just some ideas for you, some ways that we can have a little discussion about, what can communities do? Well, the most important thing, and my pastor will even tell us, is you need to know who your members are. You need to know your congregation so that when they stop showing up. You need to provide, you're the conduit, you are the trusted people in their lives. So you can be the vehicle and the portal to education. Looking at using the toolkits you're going to get to really assess your environment. Is it safe and is it friendly? And then there, depending upon the bandwidth of a faith community, there may be many ways to offer respite to caregivers. And respite is simply an opportunity to provide a caregiver with a break. So respite can be very formal respite programs, or respite can be Stephen ministers or congregational care ministers who will visit and sit with a loved one so that that caregiver can get out, can maybe go shopping, do something for themselves, go to the grocery store, or, have some time alone. And then encouraging members to adopt healthy lifestyles, which is what you are all about. These are some questions. Often when we talk to faith communities, they say, well, where do we begin? How do we even start this? And so these are just what I would call conversation starters. Have your members come together and talk about, how are we called to minister to each other? And what does that look like? Are we doing it now? What existing resources do we have? What knowledge do we have within our congregations? And that's a great place to begin. It's like do an assessment of what's going on, and that will prompt kind of what are your next steps. The next couple slides that you're going to get, I will not go over. They include our care and support resources. So just want you to know there are also some links for, those of you who are interested in the science and want to learn more about that. So that is all going to get into your hands. And I'm going to go ahead and stop the screen share so we can do some Q&A or some comments. Would just love to hear what is on your mind? What would you like to hear a little bit more about? Any sharing?
I would like to jump in. First of all, thank you so much for all that comprehensive information. And for everyone on the call, we are recording the call, and you will receive the recording with all of the slides and all of this information, because I know it's a lot to take in at one sitting. But I just wanted to ask if you could pinpoint, Corey, the ways that we can, what behaviors we can engage in or let go of to optimize our chances of not getting Alzheimer's or dementia.
Well, that is a great question. And what we can control, obviously, are those lifestyle factors. And we can look first, of course, at what we put into our body, what and how are we eating and nourishing our body. The Mediterranean diet is probably the best researched and the most supportive of healthy nutritional interventions. And that's heavy on the, low fat meats, lots of the omega that is so good for us, lots of the leafy green vegetables. There is increasing research that the Mediterranean diet, it's good for our health. It's good for our heart. So again, it improves our heart. That's going to improve all the blood flow to our brain. And if you're interested in learning more about the Mediterranean diet, that is actually one of the workshops next week. Dr. Carolyn Dunn from NC State, who is a nutritionist, is going to take us through the 7 easy steps of what it means to adopt a Mediterranean diet. And I think the language diet is kind of a misnomer. We're not talking about a weight loss plan. We're talking about an approach to eating and an approach to food. Along with that is this notion of the colorful plate. And this is also consistent with the Mediterranean diet. And this is great as a self-check, but also when we're working with younger folks. I mean, my son's 13, he eats me out of house and home. And we always do the colorful plate check, and that simply means when you're looking at what you have put on your plate, is it colorful? Are you seeing the dark greens? Are you seeing the oranges? Are you seeing the reds? And if you're not, what can you add to that? So, and an additional characteristic of the Mediterranean diet coming out of those cultures and coming out of the Italian and the Greek cultures, there's also a social engagement component to that, because food is, in those cultures, food is an event. It's not just, I got to grab this, as I'm, stuffing chips in my mouth, working at my laptop. Food is a very purposeful coming together of people. And that's where you add that social engagement piece to that. So that is one component that we talk about. And then there is simply managing all those additional conditions that increase our risk. So Karen, to your point, if high blood pressure runs in our family, if heart disease runs in our family, if diabetes runs in our family, if obesity runs in our family, the more we manage any of those comorbidities, the healthier we're going to become, and the more it's going to minimize our risk. It's going to improve our blood flow. And so much of that goes to the brain and nourishes the brain. So we need to look at our whole health and what is it that we can change about our current conditions to strengthen ourselves. Maybe we can't prevent this disease yet, but we can certainly knock out some of the risk factors, and we can improve our own resiliency in the face of disease. To that, Karen, some other details about that we've got. So let me share at next week's symposium that everything we're offering, there is a research basis to that links to minimizing cognitive impairment. So there are studies around the practice of mindfulness, and Alyssa Bate will be talking a little bit about where that research comes and then showing us some of those practices around that. Likewise, with yoga, there is a centering component, there is a stress reduction component, there is a balance component to yoga that only improves our overall health. Continually learning and engaging in new things. Think about the brain as a muscle, and the more that we can challenge it and introduce it to new things, the stronger it's going to get. Even we can do it to try to minimize risk, but even for our loved ones who are now progressing through the disease, Eileen Schwartz, who runs a program, she's an artist, and she's created a program called Healing Arts for Caregivers. And her whole work is working with individuals with developmental disabilities, with cognitive impairment, with PTSD around art, engaging in art, and working with their caregivers on activities to engage them. So it's all of these ways to connect, whether that's social, whether that's intellectual, whether it's through the fuel that we put in our body.
Thank you so much for that. And we do have some questions. One I would like to ask right away because it's linked to diet. Is there a link between sugar and Alzheimer's?
I do not know of any study or research specifically on sugar and Alzheimer's, although that part of the benefits of the Mediterranean diet is it's very minimal in it, particularly any of the artificial sugars. That is a question that I would definitely ask of the nutritionist next week. I will in fact pose that question to her. Okay. And then I will send the answer. So I do not know of an explicit link between sugar and Alzheimer's, but we know that there are detrimental effects of sugar on our bodies. And so we do want to minimize that. But I'll get some more detail next week about that. That's a great question.
Okay, thank you. So what I'm hearing then is diet, community engagement, relationships, brain flow, blood flow, which means exercise, moving the body, yoga, meditation.
Absolutely. So the buckets, if you think about the 4 buckets, think social engagement, think cognitive engagement, think diet and nutrition, and think physical engagement. And the more you can create activities that bring more of that together, the more beneficial that would be. So I think book groups, just like little examples tossing out there, book groups or Bible studies. You're coming together as a group, you are in community, and you're also studying something, you're participating in an intellectual activity or exercise, trying new things as well. So, if you've never tried yoga or you've never tried mindfulness, come on next week and try it. You'll get some physical benefits, but you'll also be teaching your brain something new. And we may not be able to replace the brain cells we've lost, but we can nourish and nurture our existing brain cells and those communication pathways.
And I would point out that at your Bible study, instead of eating donuts, you might want to try fresh fruit with some hummus.
Bring some berries, same color. So switch it to strawberries, blueberries. If you want something sweet, do a yogurt, a vanilla yogurt, and dip in that.
Okay. I do have another question here, and as the person who's asking says, it is a hard question, and I agree. Is there any advice on the apparent loss of personhood, such as when a patient can't remember family and friends, or even who they themselves are? Like how do you handle that, which I know is can be incredibly painful and confusing and distressing?
I am going to invite my Karen. I'm going to put her on the spot. So Karen Owens, and I'm going to invite Karen to talk a little bit about that, because one of Karen's roles with us is actually as a family caregiver support person. So part of what Karen does is, a lot of the outreach we get when we get referrals. And Karen, I wonder if there's every situation is different. I know every situation is unique, but I wonder what we can offer on that.
Well, I did put a link in the chat to a section on our website in regards to memory loss and confusion. And I'm sure, Corey, we can include that in the email too, just so folks have that. But I think it's really important. And I say this from a professional standpoint and a personal standpoint, because I've had multiple family members affected by this disease now. And it's really important, as best possible, and let me preface it with, it's not always easy to do, but to not take it personally when someone doesn't remember exactly who you are or what your name is, because it's not a reflection of your relationship with that individual. It's not a reflection of how they feel about you. It's a reflection of the disease process, unfortunately. And so the biggest thing in those situations is just to maintain that connection in one way, shape, or form. Whether that's through just having conversation, if they're still able to conversate and utilize language to communicate, or whether it's just sitting there and holding their hand, or just sitting with them, listening to some music that you all shared together and had a love for. So really the biggest piece is trying not to take it personally, because that certainly can affect our interaction with individuals. And again, I'm not saying that's easy to do, by no means. I know my grandmother didn't recognize me anymore, and that was hurtful. But I was also a teenager and didn't know what I know now. So if I could do it differently, I certainly would. But trying to maintain that connection is really important. You can try to use photographs and things like that to help. The one thing you just want to be mindful about that is, for both parties, photographs can sometimes be a very, very emotionally charged, and so can certainly prompt some emotional responses from both parties. But photographs can be a great opportunity to connect and just revisit times that you've shared together. But really, it's about connecting with the person wherever they are that day, and however you can based on where they are. That's the broadest, best answer I can give.
I would add kind of two things to that. One is just a very simple example that a caregiver, we actually have a video of her, talks about. She was caring for her mother, who was very far along in the disease, and similar. Her mother did not know who she was, but there was enough of a sense of safety present that the daughter could touch the mother, and so the daughter just brushed the mother's hair. She would just go over, and the mother had long, thick hair and would just brush it and braid it. And the caregiver, of course, is behind the mother doing this, but she tells the story of her husband, the daughter's husband, looking at her and saying, I'm looking at your mother's face and I just see peace because of this motion, this touching motion. Also understanding anticipatory grief is so important for caregivers, and we've got some resources around that we could send out too, but it's it's prepare maybe isn't the right word, because you don't really know what's to come, but understanding grief and how you grieve and what you need to do in those moments when you're grieving would be very important. And then caregivers often tell us that, and Karen Dunn, you used these words earlier, especially caregivers of faith often tell us that even in the darkest moments, there is grace present. And that's that connection that we're talking about. And it may not be a connection of recognition. It just may be this just primal connection through touch or presence.
And I would add too, Corey, just thinking about ways that you can connect with the individual, your loved one, that they enjoy, again, based on where they are that day, because it does change as the disease progresses. But I know, for example, one of my family members, she used to love to just get in the car and ride. So, it didn't matter where the destination was, because when you got there, she was ready to go to the next destination. But it was just something about getting in the car and riding, or grabbing her favorite drink was Sunkist, and a cheeseburger. So, thinking about ways you can connect while doing something that maybe you did together, or something that they love to do, because that sense of self is still there, and those things of value are still there. It's just, how do we connect to that in a different way? And that's a great opportunity, just to share in time together.
That relates to, there's some great things I just picked up in the chat. So a question that, what we were just talking about with the hair brushing, this question is, I wonder if there are other emotionally regulating behaviors that can help in episodes of anger and confusion. And I would say absolutely, but they're going to be individual, so it goes back to that, your loved one's preferences. And, I would really encourage doing a deeper dive into that, even using our helpline. You can call our helpline and talk with a care consultant who will help you probe through that. You can call them and just say, look, I'm trying to figure out what I can do to help mediate during those particularly difficult times with anger and with confusion. And the care consultant, will do that back and forth with you and help you come up with a plan. There's another caregiver that tells the story of her family's Greek, her husband's family is not, and her mother was living with her and her husband and had reverted back, which is very common, to her native language, which was Greek. And so when the mother had an episode of anger, she would yell at her daughter in Greek and just say absolutely horrible things. And the daughter knew, I shouldn't take this personally. I shouldn't take this personally, but you can't help it. The husband didn't understand Greek. So it was an absolutely perfect, what they did was, when mom would move into these anger episodes, she was okay in the car. So the husband would redirect and take her for a drive and go get ice cream. And that would give that daughter caregiver time to just center and relax and get away from the anger.
Yeah.
And for the
Thank you.
husband, since he didn't understand Greek, he didn't know.
Yeah, I mean, it was
out, so
that was great. She would fuss a little bit and then stop, then start calming down in the car. And, she, even though they couldn't communicate again, because, she wouldn't have understood much anyway, but he obviously didn't speak Greek. She was still, that was a place that at that time was safe for her. So she felt safe to be in the car, and they had that little routine. And but it's going to be very individual, but those are very, very good things to kind of think about as you create your own caregiver toolkit.
Thank you both. That's really helpful. And I think it's wonderful you have a helpline that people can call when they're in the middle of that situation and they just don't know what to do. Just knowing that there's someone there who has some expertise and will just listen to them, I think is really helpful. And then Jamie says that's important, the caregiver regulating themselves too.
Absolutely,
Yes.
because as the caregiver, your language, your body language, your emotion, your loved one's going to pick up on that. Even if there's not the clear verbal lucid communication anymore, when you get heightened, they're going to feel it and it's going to trigger them. So it's so important. We have another caregiver who said that with her husband, it finally got to the point where anytime he opened his mouth, she knew, she's like, count to 3 before you respond. Now, prior to the disease, he would have said something, she would have said something, they would have just gone at it. And that was kind of routine, but she could not act impulsively anymore. That would just heighten that situation. So she would just practice that really slow count to 3 before she responded. I did want to say also about the helpline, and we put the number in, that is available 24/7, 365 days of the week. There is absolutely no charge. You can get just basic information. You can have a care consultation. And if 4 o'clock in the morning is better for you, there is somebody there at 4 o'clock in the morning to talk to you.
Wow, that's fantastic. Thank you. It is almost noon, but there are a few more questions. Maybe if we could just try to do these. So one person is asking, there's a question about faith engagement with the community, but also one about sleep, which is how does sleep or lack of sleep schedule contribute to risk factors? Like what is the mechanism there?
So, the very kind of the most immediate ones, it's the whole ability, it goes to circadian rhythm, and it's that ability to rest the body. And if an individual is not sleeping, they're further muddling their brain. So it's just adding on to it. It increases, lack of sleep or poor sleep increases confusion. It increases fall risks and a loss of balance. So it's important to try to regulate that. The, routine is important. And, an inconsistency, if your loved one naps regularly at a certain time every day, that's routine. But if they nap here because they're not sleeping well at night, that there's no pattern there and the body has no way to rest. I don't know, Karen Owens, would you add anything else to that? I think the increasing confusion and increasing fall risks are 2 of the key.
Well, I would just say one thing to add to that is the best way I know to describe it is, when we go to sleep, that's when our brain has the time to do the repair work that it needs to do. And so it's kind of like, how if you don't reset or restart or shut your computer down for a long period of time, it runs a lot slower. It doesn't get to do the updates it needs. And so when we go to sleep, that's when our brain has that opportunity to reset, if you will, or do the updates, so to speak,
Yeah,
and do that repair work that's essential for our brain to function to the best of its ability. So sleep's definitely important to our cognitive functioning in a lot of different ways.
Thank you. There is one last question, and it's a perfect question for me to end our webinar this morning or this afternoon now. It's about engaging the faith community, and how do you do that when you meet resistance? Because there is some stigma, I know, and there's certainly a lot of fear around Alzheimer's and dementia, and people don't necessarily want to talk about it because they're frightened or they're embarrassed if they have some diminishment in their cognitive ability. So how would you suggest people engage that when there's resistance?
That's why starting with awareness and starting with the difficult conversations is so important. I mean, you're right. I have reached out to churches to talk about what we do, and we'd love to provide some support to you. And I've had people tell me, oh, nobody has Alzheimer's here. And I've had people tell me, oh, people don't want to talk about that. That just depresses them.
Mm-hmm.
But it's, recognize what the resistance is and then develop the strategy. There's not necessarily a one size fits all, but starting with awareness and engagement in the less stigmatizing ways. So initiatives around healthy living, for example, who's not going to embrace that? That can be a very subtle way to begin to introduce this topic. If we just start doing health and wholeness and wellness education and information, that can lead to introducing brain health and the importance of brain health. And then we can really get into the details. So oftentimes that's the best we do. We've had very good response to our program, Know the 10 Signs. So when I was talking earlier about those 10 warning signs,
Mm-hmm.
we've got a 30-minute version, a 60-minute version of that program. And the objective really is to distinguish between kind of what's normal aging and what's not. It's not to say everybody's going to get Alzheimer's at all. It's just to make that distinction in general. And so that is also a very nice, safer way to introduce the discussion, and often as well will engage that sandwich generation. So it's not that you're targeting only the seniors in your community, but what about the folks like me? I have a school-aged child I'm raising, but I've got an elderly mom with Parkinson's. So to engage that audience is also we're a little bit more open to, we're feeling it. We've got to understand this stuff and know where to go and what to do. And, the church or the faith community of which we're members, they are the trusted people in our lives, right?
Yeah.
Does that help, Karen? Does that kind of answer that question, do you think?
I think so. And just to add to your point, since we are coming to the end of our time, as I mentioned, this recording is going to go out to all of you who are on the call, along with Corey is going to be sending me resources to go along with the call in response to the questions that were asked. So you will have all of that sent to you very soon. But in addition to that, also, as the healthy aging person, the associate director for PHW, I've also done a healthy aging guide, but I'm also doing a healthy aging toolkit that's coming out this month. So that will be included with the resources, and that will address how to engage your faith community around these issues as well, around all issues related to healthy aging, but specifically also Alzheimer's and dementia. So you are going to be receiving this cornucopia of information as soon as we have our recording ready for you. I would encourage you as well to register for Corey's symposium that she's mentioned next week, because it's divided up over, I think, is it 5 days, Corey?
It is 5 days. There's 7 workshops, and you can pick and choose. Those will also be recorded. So if you register in the event that you can't make it at the last minute, by virtue of having registered, you will get the recording and the follow-up materials. If you know you can't make it, but don't want to miss it, go ahead and register, because again, that will put you in the queue to get the recordings. And there's 1 to 2 workshops each day. I put in the link as well in the chat to click right on that.
Yes, and all of you who receive our newsletter or our emails, we also send out the registration link to the symposium next week as well. And we know that having just 1 hour to talk about this is not nearly enough. So I do encourage you to register for the symposium, where you can really do a much deeper dive into the individual aspects of Alzheimer's and dementia. But for now, it's about 10 afternoon. So Corey and Karen, thank you so much for your wonderful presentation. It was so comprehensive and helpful. And for your other staff members who joined us, and for all of you who joined us for this conversation, thank you so much. And in closing, I just want to offer a blessing upon all of you who are struggling with this illness, whether it's something you've received a diagnosis for yourself, or someone you love has received that diagnosis, especially if you're a caregiver. I just want to say that, we at PHW are always here for you. And God is always with you. And I know how difficult the disease can be, but I hope that you can find those moments of grace and mercy as you walk that journey. So for now, blessings upon you, and be well. And we will be in touch very soon. So thank you again for joining us today.
Thank you.
Thank you.